Welcome to Disaffected. I'm Joshua Slocum, and this is the show where we talk about politics, culture, and relationships through a psychological lens. And this is an audio only episode being recorded. No, it's not January, is it? It's June. June 15th, 2025. And my guest is Dr. Hannah Spier, who is a psychotherapist and psychiatrist in Europe, who was on the TV show that comes out on Sunday very recently. And we got into about a 25-minute conversation, and there's lots more to get into. So, Hannah, welcome back. Thanks for sitting down with me again.
Thank you so much for having me on again, Josh. I'm really looking forward to this conversation. It was so great to be on your show.
Yeah, no, I enjoyed it. So, for those who didn't catch that show, as I said, Hannah is a psychiatrist, and what drew my attention to her, she writes on Substack. Um, and that Substack is Psychobabble with Hannah Spier, and that's Spier. It's combination Substack blog and a podcast. She also does podcasting. They're both called Psychobabble, so you can find her through her Substack. And what drew me to her was some of the short essays and commentary that Hannah put up, noticing something that I've noticed, which is the cluster B, the narcissistic and borderline personality style, really seeming to take over not only culturally, and I do believe it's taking over culturally, but specifically in the mental health field among the practitioners, among the credentialed people. So why don't we just start out with that, give a little bit on that, and tell me what you've been seeing, Hannah, and what concerns you.
Yeah, so what I've been seeing is that, well, I first learned about this obviously during my residency, and I was quite naive before that going in. So I was quite stunned because my expectation was I'd be working with psychosis and schizophrenia and those disorders. But then I just met a lot of people with these cluster B conditions. And so I learned about it in a clinical setting. But now, if you open your eyes, you know what this condition looks like in the extreme cases. You can start recognizing a lot of these traits, exacerbated traits, everywhere. You see it not just in therapy. So I saw it a lot in the hospital, but you see it in schools. You see it in institutions. You see it in HR departments, everywhere which is now become female dominated. And if you look and you're not ideologically possessed, you can start seeing, yeah, okay, we have a lot of reports of increased bullying in these sectors that are female driven. And I think that it's all connected to this condition that is very underreported. We don't recognize it properly. And so people go undetected.
Let's clarify some terminology usage and try to normalize it so we're talking about the same thing and the audience knows that we're talking about the same thing. Um, so we have cluster B personality disorders, borderline, narcissistic, histrionic, antisocial.
Exactly.
And I think you and I agree that it's usually more accurate to think of the mindset itself is accurately described as cluster B, but that each individual patient really does have a helping of different traits from what are labeled four separate disorders, but which really overlap a lot. So I think, and correct me if I'm wrong, but I think that
Mhm.
both you and I agree that there are not hard and fast walls between what's a borderline, what's a histrionic, what's a narcissist, but that there's a commonality in cluster B. Does that reflect your point of view as
Yes.
well?
Yeah. And if you, since we now have time, we can even go a bit further back so people get a complete overview.
Oh, please do. Yes, let's
Right.
do that.
Yeah. So, because we keep using the term cluster B.
Yeah.
So, what are the other clusters? What are we talking about here? We're talking about personality disorders, which they have to be differentiated from other psychiatric mental disorders. And it's something completely different, and people don't know that. So, we classify personality disorders in these three clusters: A, B, and C. And a personality, some not just some, a lot of clinicians are opposed to this term personality disorder in general, because how can your personality be disordered? It's a bit unpalatable for some.
Okay.
Because these are really adaptive strategies we're talking about. And no one is born with a personality disorder. This is something that develops in childhood, teenage years, and that we cannot properly diagnose before adulthood. And so in that way, it's separate from something like schizophrenia. We have to look at it in a different
Yeah, this is
way.
good. What tell if you would, I think you're going there, but I want to put a sharp point on it for people.
Mm.
The way I talk about this is I differentiate between what I call classic mental illness, things like major depressive disorder, schizophrenia, manic depression slash bipolar. I differentiate those from the personality disorders. How do you differentiate? How would you
I
describe it?
think that's I think that's good. You can also say more a neuropsychiatric that there's more of a neuropsychiatric element to schizophrenia and bipolar. But many psychiatrists are also coming out and saying, look, we're overdiagnosing schizophrenia and
Hmm.
that there are blurred lines in all of these disorders because in psychiatry, well, it isn't an exact science. We don't really have imaging that can say you
Right.
have this or you have that. This is why there's this very famous study done on a bunch of American psychiatrists and a group of British psychiatrists being given the same patient and coming up with wildly different diagnoses. So this is very important always to remember in psychiatry that we don't have that imaging, the X-rays, the lab results where
Right.
you can say it's purely based on exclusion and the clinician sitting there and with which lens that clinician looks through with their own experiences and worldview. So that's what I really try to expose through psychobabble. And so I think that you're right. We can really differentiate between schizophrenia and bipolar from a purely neuropsychiatric view, and florid psychosis, these disorders. And personality disorder is something different. So you are born with traits, with personality traits, and this is from 40 to 60% hereditary. That's very important. But then we have to ask the question, why do we see that one sibling in a siblings group
Hmm.
develops a personality disorder while the others go on living functioning healthy
Yeah,
lives? Well, that's interesting. That's a
it
good
is.
question. And so why do we keep using the term personality disorder? For psychiatrists, it's all about functioning. It's all about how are you functioning in the world. Like we're doctors. So it's less analytical, more how are you able to keep a stable job? Are you
Hmm.
able to keep a long-term relationship? Are you able to have hobby, leisure time? How is your life satisfaction?
Yeah.
So this is sort of, we look at it at these. So if you diagnose a personality disorder, you have to prove that this person, because of their behavior,
Hmm.
because of what their personality is, they have lost, impaired functioning in all of these areas.
Okay.
So your personality leads you to behavior. And if because of your personality, you're not able to function, we diagnose a personality disorder. But again, most say so this is problematic.
Well, let's talk about why some people think that's problematic. Um, I'm going to tell you what some of my perceptions are. I don't guarantee that they're right, but I want to honestly tell you what it looks like to me. Um, what it looks like to me when I hear professionals who say things like we shouldn't even have the ontological category of personality disorder,
Mm.
that we shouldn't diagnose what we call borderline personality disorder because instead it's a trauma disorder. when I hear this stuff and when I see it, and I've seen a lot of it, I'm afraid I don't quite believe the claim at face value. I don't quite believe that the claimants are motivated by what they claim to be motivated by. And I know how that sounds, and I'm sorry, but I don't actually think that for many of these people, I don't think it's accurate that what they really want is just to get more accurate in our differential diagnoses and more helpful. I'm sure that is a motivation, but I actually think the motivation, I can't help but feel like they're trying to make something that is extraordinarily abnormal and harmful be perceived as not as abnormal and harmful. Like I hear a lot of talk like we need to get rid of the stigma. And when I hear we need to get rid of the stigma, I become defensive immediately because I don't think we need to get rid of the stigma. I think we need to bring a lot of stigma back to a lot of things.
Mm.
And I don't mean, this is what I don't mean. I don't mean that clinicians should be cruel. I don't mean that they should refuse to help people. That's not what I mean. I have been helped by psychotherapy myself. However, this don't judge and this is stigmatizing, I think is part of the overall cluster B problem. There are some behaviors that should be socially stigmatized. That doesn't mean that treatment shouldn't be available, and it doesn't mean that patients should feel morally judged all the time when they're sitting with their therapist. I'm not proposing that. But societally, anyway, I've gone on too long. So that's what I hear when I hear this. Well, personality disorders don't really exist anyway. What's your, where do you sit in this?
I completely agree, and I've spoken to psychologists who have given me this answer about their problems with this term personality disorder, and they don't have an alternative where I think, okay, I have to use this clinically, and I have to sit and help these patients, and you're not giving me a viable alternative. And when we blur the lines further, because what they don't seem to want to clear up are these blurred lines in psychiatry, because we are already struggling to be a medical field. And so this is not the time to say, oh, well, this isn't really a category that we can use. I think that categories are very useful as a clinician. And I think I've seen that patients are relieved when they get a firm diagnosis where they know,
Mm,
okay, I can place myself here, and this is the reason I am like this, where I have trouble with this, and this is the reason I have to go on doing things a different way. And so I have no problem with the term personality disorder, but I think we need to stop misunderstanding personality. A lot of clinicians don't know anything about it, and so they
that's astonishing to
confuse.
me.
Yeah, yeah. This is very frustrating. I don't want to go on a different tangent here, but that is largely the problem with the trans ideology, because they have replaced personality and temperament with gender.
Yes, yes.
And it's because of this. I don't know if they don't know or they misunderstand or they purposefully ignore it. But if you read through the questionnaires questioning gender, this sort of the gender unicorn, all that, these are all taken from personality
Yeah.
research, from terms that we use to establish what personalities we're talking about. And the best research we have on personality, that is the five factor model, the big five. That is the best cross-culturally actually replicated, because
Tell
we do
people what
have
the
a
big five
replication.
personality traits are.
Yes, so that is neuroticism, which we will continue to talk a lot about, I think. Extroversion, agreeableness, conscientiousness, and openness.
Yeah. If I may, there's a psychologist on YouTube named Dr. Todd Grande, who I watch and enjoy a lot, and I like his mnemonic for this. The way he remembers the five factor model is with the acronym OCEAN: openness,
Mm,
conscientiousness, um, extroversion, agreeableness, and neuroticism. So
yeah,
OCEAN,
that's
I use
clever.
OCEAN to remember that too.
Oh, yeah, that's
But
clever.
maybe I'm just biased as a native English speaker.
Yeah. But that wasn't something that I learned during during my psychotherapy.
Really?
That was not something we went through. That was stuff that I got to on my own when I researched. They give different psychoanalytic theories, and oh, we have all these different
Yeah.
theories, and that is another problem with psychology is that it has become victim to a lot of ideology and
Yeah.
postmodernism, and so that's why these opposing theories continue to they coexist simultaneously because we
Right.
don't have a governing body. We're not struggling to be a science. It's simply, oh, if you disagree with something or if you don't understand one thing, you simply say, well, I follow a different school of thought. And then that's just okay.
Right.
That's just allowed to
Yeah,
live
no, that's
on.
just confusion. You
Okay. Yeah,
said
but
you
back
said
to, sorry, then back to that.
yeah. Well, there's something I want to make sure we get to. You said earlier in the conversation you talked about exacerbated traits. So we were
Yes.
talking about personality disorders and then exacerbated traits. And I think I
Yes.
know there's a differentiation there, but I'd like to tease that out. When you say
Yeah.
exacerbated traits, what exactly do you mean? Do you mean personality disorder? Or do you mean not quite personality disorder, but somewhere in the neighborhood? Or do you mean something different?
Yes, I mean something on the way to a lot of people with exacerbated neuroticism, excess neuroticism, would be diagnosed with BPD or histrionic
Hmm.
personality disorder if they came across the right clinician,
Okay.
or if they went. And a lot of the times they don't go to get diagnosed, or they go for a depression and then that's it.
Yeah.
You really have to follow someone for a long period of time to recognize, okay, here we're talking about a borderline personality
A
disorder. You have
long-term
to think
pattern.
when exactly you have to be able to establish that pattern. And because a lot of clinicians hesitate to say, I think you have borderline personality disorder, because who wants to say that to a person? I think
Right.
you're, right? It's a bit, you feel
I do
like
know
you're giving a
clinicians who are
moral
able to say
judgment.
it. I,
Yeah,
I,
I have, but then I also have known that patient for a long time, and I have to justify them when I have to
yes,
give concrete example because this happened and remember in this relationship, and you have to be able to
right.
give concrete examples that can, because this is a long-term pattern. That's why I have to say this is about maladaptive strategies. So
Yes.
you are born with a lot of neuroticism, if you're high in this dimension. And then, depending on your environment, let's say, your parents don't attend to you properly, which it's fiendishly difficult to parent. We don't tell people that. It's so hard to give kids the proper responsiveness, and especially when we outsource so much of our parenting. How can you, if you are away from your kids 8 hours a day, every day, how can you know that you're attending to them properly? And if you then have a child who is born with a lot of neuroticism, so they need
Yeah.
more soothing, they need to learn emotional regulation, because cluster B is a disorder of emotional dysregulation. That is why they harm themselves, because they have so much intense emotional
Yes.
turmoil inside, and they cannot express how they feel inside.
Yeah.
So they use pain, physical injury, as a way of communicating. I have so many patients who'd say, I wish I'd just broken my leg because I'm in so much pain and nobody understands me.
That actually that I think I understand just from you saying that. I think I understand that response a little bit better than I have before. Because that self-harm behavior is sometimes it's hard to get to wrap your mind around the motivation. That helped clarify for me. Thank you. Let's
Mm,
let's talk about the exacerbated traits in the mental health profession because that was and we're in this conversation. For those listening, I'm sorry, I shouldn't have waited this long to tease it. We're definitely going to get to a topic that came up during my conversation with Hannah on the TV show. We're going to talk about because this got it perked my ears up, but it also perked up the ears of some commenters when you said that you have some patients who claim to have been abused and mistreated by narcissistic parents, but then when the parents come into therapy and you meet the other family members, you don't have the same perception. So people immediately keyed on that and said, "Oh, wait a minute. My narcissistic mother put on a very nice affect and masked and fooled other people. So you can, I'm sure you've dealt with this before. I'd
Hmm.
like to get to that in the second half of this, but what I'd like to go back to right now is I I I see, well, first of all, the mental health field writ large, everybody from licensed clinical social workers all the way through to clinical psychologists, psychiatrists. I'm speaking generally. I know there are differences, but I see, well, first of all, the field itself is now dominated by women. The proportion of female practitioners is, I
Around
get
80%
about
more,
80%, right?
85%. Yeah.
And I have noticed that many of the prescriptions that these practitioners say, this is what you should do, this is a healthy kind of ego development, this is a healthy way of expressing yourself, they're they're actually they're validating cluster B behaviors. They're validating intense emotional tantrums
Hmm.
in their clients or potential clients. They're saying, you're speaking authentically. They are these practitioners are often um, emotionally dysregulated themselves, or they are so attached to a leftist political ideology having to do with gender, having to do with being anti-capitalist, having to do with hating authority, definitely feminist all the way through. Men are bad. These practitioners themselves strike me often as very cluster B behaving.
Yeah.
What do you see?
Yeah, I saw this firsthand. They're sitting next to psychologists who had cuts all up on their arms and uh, really I caught them in hysterical fits. And they were really, I deemed them, I
You're
thought it
saying
quite
them, but is it
inappropriate.
she? Is it she?
It's all women. Sorry, of
Okay.
course,
Yeah,
all
no, no. I'm
women.
not I'm not I'm not trying
Yeah.
to step on you. I'm going
No,
for
no, yeah,
clarity.
yeah, yeah, yeah. No, I thought it was quite inappropriate that they were treating patients at all. But there are so many patients to get to, so you really can't, it's easy to get a job. But I think that they are, it's, sorry.
Yeah, I know it's true. It's just so grisly, you know.
Yeah, but I'm of the opinion that this is not really something that can be treated. It's
What is
something
not
that
something that can be treated?
cluster B conditions, personality disorders.
Okay.
You can get to better functioning, but
Okay.
you will always struggle with emotional regulation. That is something that will follow you.
Okay.
If you are a narcissist, you can learn to function if you but did you know establishing insight in someone who's a narcissist. I No one has told me that they achieved this,
Okay.
and they maybe we can get into that later, but they claim that it's so treatable from this one study that they did,
Okay.
where they did a follow-up study of 10 years, and then the whole psychiatric community jumped for joy because, it's treatable.
I think I remember
And
seeing that study, and if it's the same one, I if it's the same one, I was shocked. I found it unbelievable on its face. If it's the same one, they were claiming something like a 90% success rate in getting.
99.
Oh, okay.
two
So I think
years
I
was
am
Yeah,
looking at the same
yeah,
thing you're
yeah,
looking at.
because it got a lot of
That's just not
attention.
believable, is
And
it, Hannah?
so I went through it, and
Okay.
I was like, and I thought, well, then a lot of my borderline patients would classify as in remission, because what they were talking about were
According to
just
you or according to them?
according to them,
Okay.
because they weren't talking about psychosocial recovery. They weren't talking about social functioning, which is what makes us diagnose the disorder in the first place. They were talking
Okay.
about symptom relief in mood stability
Okay.
and self-harm.
Okay.
But they don't count, for example, tattoos and piercings towards self-harm. They count cutting, burning. And so they're doing these sort
Okay.
of the tricks, and then they're claiming 99% have 2-year remission.
Yeah, I just simply, that's just not
78%
believable.
over. No, it's quite astounding. And so that
Were they looking at borderline, or
yeah,
in their view, were they looking at borderline, or in their view narcissism?
Well, that's the funny thing. They included 197 participants, but only a third of the group were borderliners. The other groups were depression
Okay.
and another disorder, which I don't. So,
That's
so
not
it
a
wasn't a
coherent
very,
set.
no. No, it wasn't. So this is so I think that when these cluster B clinicians, as I call them, I don't think it's appropriate because what is at the heart of the borderline disorder, the cluster B conditions, let's call them that in general, it is a lack of insight. It is this not knowing yourself, not being able to soothe, not being able to separate yourself from other people. They
Yeah.
have a disturbed self-image. They have problems with their identity, and so and they always very reflexively blame their parents. Right? It's the parents' fault because
Okay.
they themselves feel that they were abused from their parents. Uh, if that happened or not, that is
Yeah.
their perception of the world. They live in a victimhood narrative that they created, and so they that is what they will see in their patients, and they infantilize them instead
Ah,
of encouraging agency in their patients, which is what they need, what patients need. They need to feel, okay, I can overcome this, and this is what I need to do. They don't need to sit in this just fester in victimhood. That will not
yeah.
help you, no matter the disorder.
Yeah. This is a good time. Let's take a quick break here, and when we come back, we can get into I want to get into that more. The perception of victimhood, the reality versus perception of abuse, those sorts of things with parents. I'd like to hear what you've seen in your office, and I'd like to introduce a little bit, a couple of anecdotes of mine in my relationship with my mother, and see how they play out there. So those of you listening to Disaffected who played the drinking game, get your shots ready because I will be using the phrase "my mother" a few times. So if you wish to get drunk, this is the time to get the bottle out. Let's take a quick break, and we'll come back on the other side. Do you get something from Disaffected you don't find anywhere else? Well, you can help produce the show. Supporting members get access to our private Discord chat server, meetups, and audio episode recording sessions with guests. Sign up at disaffectedpod.substack.com or at subscribestar.com/disaffected. Okay, we are back. And before we took the break, you started, Hannah, to talk about um, people who have the perception that they were abused by their parents. And this brings us into the part of your appearance on the show last week that really interested viewers and uh, I think activated a couple of them. Got a couple of people got a little bit irritated
Mm,
because what they believe they heard from you was that you have these patients who say that they were abused by their parents, they're traumatized, they had a child abuse background, but then the parents or other family members come in as part of the therapy and you say, I didn't detect this kind of behavior on the part of the parents. They seem to be wonderful people. And what commenters said back, and these things occurred to me as well. And we're having a conversation about it. This is not like a gotcha, but it occurred to me as well. Um, how do you tell? Because a lot of cluster B parents, I mean, many cluster Bs are simply habitual liars and impression management masters. They will put on a public face in front of other people so that they don't lose face, but it's very different from the person they experience at home. And I've had some of that experience myself. I can only ask people to trust me that I'm telling the truth to the best of my knowledge. I mean, my memory is as fallible as
mm,
anyone else's, and I'm sure I've confabulated some of my history because humans do that.
mm,
But I really do believe my mother was a quite severe borderline and narcissist. We did have lots of physical and emotional violence and poverty and addiction in the household growing up. Um, And when I was both my sister and I actually, when we were teenagers, were institutionalized. We were taken out of our homes by family court and placed into group home care settings, basically glorified orphanages for juvenile delinquents. Uh, we did have many problems as teenagers, yes, but they were problems that came from the abuse at home. So we've perceived, and I believe that we're correct about that, that like many children, we were punished for our mother's actual crimes, actual child
Mm-hmm.
abuse crimes, but we were the ones who went to jail. So
Yeah.
let's get into that. Let's talk about what
Yeah.
happens when you get family members in and how you differentiate between who's telling the truth and who isn't.
Yeah, of course, of course. So, what I meant was that I sat with people who had been referred to me as trauma patients, but it was not something that it was not the trauma event, which is
Hmm.
then what you're looking for as a
Okay.
therapist, was was never properly revealed. And that's then slightly suspicious because then I'm wondering, is it a trauma that we're dealing with, or what is it that we're dealing with when the story doesn't come out,
So
right? If you're
are you
talking
saying
about
that
it, so
people will say they're traumatized, but when you say tell me what that trauma is, they won't tell you, or is it
yeah,
some
that it
other
would be
something else?
described as a sort of a black box, something that happened, like they're uncomfortable around that part of the story.
Oh, so they
So
would
that
not say
they would
that.
not say, they would not tell me about the traumatic event, but
Okay,
that's fine. That's fine. You don't have to
sure.
disclose everything.
Well, eventually you're going to
But
have to
so
if you want to
that
get better.
yeah, that's my, you have to tell me everything.
Yeah.
And but a lot of therapists say they gloss over that and they say that's fine. You keep your black box and let's work around the
Okay.
feelings, I don't think that's a good strategy. But of course, narcissists are good at lying. Of course, it's not something that I'm good at people, and I've met a lot of narcissists, and I can tell when something is too good to be true, and but I do think a lot of these personality disorders develop in seemingly ordinary homes.
Okay.
They have a much a stronger tendency to develop in foster care, people of alcoholic parents, and so that's why the diagnosis is revolving around these very specific groups. But my point is, I think that this cluster B is much more prevalent because we're focusing on the extreme cases, and I
Okay.
think it takes much less to quote unquote traumatize a child because, and I'll read something
Oh,
to you.
okay.
Yes, yes. Because so I never doubted that these people, when I say, okay, I had their parents, both of them, in
Yeah.
the room or a sibling, and they might have been terrible parents. But did a trauma happen? Because when I have someone with a PTSD,
Hmm.
that is a very different type of patient than someone with a cluster B condition, because the
Okay.
PTSD patient is a person apart. They don't want anything to do with other people, right? They are completely in there, they are completely governed by that one traumatic event, and they were normal, quote unquote, before
Right.
the event. Then it happens, and they can point to that event, and then they became a different person after. And where a
Okay.
personality disorder that came on that came on from childhood, that was predisposed, that develops slowly, and it's difficult to locate one specific event to when everything changed. And so they
Okay.
made this new category, very poorly defined,
Okay.
CPTSD
Yeah, I
complex.
want to talk about that.
So they're saying yes, but this is constant abuse over time. So they
Yep.
sort of to explain that.
Okay.
And my problem with that is, okay, here
Okay.
we have yet another vague, poorly defined term. What am I going to do with this as a clinician? And the therapy doesn't work That is the biggest
Okay.
problem. Whereas you have established therapies tailored to borderline
Hmm.
personality disorder, then they are the best we have. And then you sort of have to see, okay, this is tailored to the borderline personality disorder, where we are able to establish some functioning. But if you take someone with a borderline personality disorder and you apply therapy tailored to trauma disorders,
Okay.
you will only encourage that person in their victimhood narrative.
Okay. Okay. There's a lot there. Um, I want to talk about PTSD and CPTSD, and then I want to talk about what a trauma disorder is and what it isn't. Um, my conceptualization has been so far.
Mm-hmm.
I have found the C PTSD, complicated or complex PTSD. I have found that construct to be helpful. I may be deluded. I mean, I'm willing to change my mind, but I'm just describing to you where my mind has been. I have applied that construct to myself, and I have seen that, and I have thought of other people in terms of that construct and what makes sense to me about it. And I may be wrong. You might be the one who changes my mind, but what has made sense to me about it is the the recognition of the constancy, the years long experience of the child with an abusive parent, right? So
Mm-hmm.
I know I I'm just using myself as an example because I know the most about myself. Other people will be different. Um, there were many events in my childhood that were obviously traumatic. Watching my stepfather try to murder my mother is one example. Several severe beatings from my stepfather and from my mother are other examples. Family tragedies and things like, there were
Mm-hmm.
real traumatic events that if you caught them on a camera, everybody would look and see that's abuse. So those things definitely happened.
Yes, but abuse, not trauma.
Okay. Okay.
We have to be specific in our wording. I don't doubt
Okay.
people abuse and neglect, but trauma is something and has to remain something specific.
Okay.
Otherwise, we blur
Tell
the lines further.
Okay, understood.
Yeah.
I think we're getting to definitional. We're figuring out where definitions have been used and
Yeah.
misused. Um,
Yes.
but just to finish that thought, the constancy, the years of living in a household with a woman who was completely emotionally dysregulated. Um, um, my mother had severe identity stability issues, severe neurosis off the charts. She was a habitual liar who often did not know she was lying, if that makes
Mm.
sense. Or she'd
Mm-hmm.
lied to herself enough until the lie became the truth, and
Yeah.
and she really messed with us children's heads. She
Yeah.
would, I'm sorry to use an overused term, but it is accurate. It was a lot of
Mm-hmm.
gaslighting. It was a lot of telling
Mm.
us that things we saw with our own eyes didn't occur,
Yeah.
and claiming that we had done bad actions that we never actually took in the real world. This
Yeah.
was my childhood. And the years of that psychological abuse, I do believe had a cumulative
Mm.
effect on people like me. Does that seem
Mm-hmm.
reasonable?
Absolutely. I'm so sorry that is your
I'm
has
not, oh
been
no,
your
no, I'm
experience.
saying it
It's a
only for
completely,
descriptive purposes. I'm
yeah.
not asking for sympathy or
That's
anything.
But so may I ask what
Sure.
that has led to, what sort of problems that has led to in you?
Yes. Yeah, lots of them,
Mm,
and this is speculation on my part. I can't know this. To
mm,
my knowledge, I have not ever been diagnosed with borderline or histrionic personality disorder. If I was as a young man, that's not known to me.
mm,
But I do suspect that in my late teen years, through most of my 20s, I probably would have qualified for a BPD or an HPD diagnosis. So
mm.
I have
Why?
had extremely elevated neuroticism, um, numerous and profound cycles of depression, OCD, and real literal OCD. I mean, with 5 hours of rituals and intrusive thoughts. I'm not just saying
Mm,
a little stressy. Um,
mm-hmm,
um, and massive problems with emotional dysregulation, especially when I was a young man. And I think as something that came along with that was, a couple of decades of chronic alcoholism. certainly made
Mm-hmm.
all of this worse for me.
Yeah.
Uh,
So
so
that would count as self-destructive behavior. Yeah.
yes,
Yeah.
yes. Now I'm 50 years old, and it's different now.
Mm-hmm.
If I would describe myself, I do think that I still, in my psyche, still has the effects of that long-term abuse.
Mm-hmm.
I still have difficulties with emotional regulation, and I still have traits that I recognize as histrionic and borderline.
Mm-hmm.
My perception, other people will are different. There are people out there who think
Yeah.
that I'm as cluster B as they possibly come, and that my entire presentation to the world is merely projection of my own pathology. So you'll have to make your own
Wow.
decision. um
That's harsh.
well, I mean, but
Yeah.
it's that
Yeah.
is what some
So,
people say.
yeah.
So
Yeah.
I don't think at this point in my life that I would qualify for a cluster B diagnosis, but I think as a young man I did, and I think that I still
Mm.
have elevated traits. That's the best I
Yeah.
can tell you.
Right. Because we do tend to calm with age. It's the worst at this 18 to late 20s,
Yeah.
and then we tend to calm with age, and we calm even more if we somehow manage to get into a stable environment like a family. So this is why I tend to say we need to guide women better towards making these stable environments, because now women are not living the way they are evolutionarily primed to, and I think that's exacerbating all these cluster B traits. But it
Interest
sounds
I
like, well,
aren't
from
yeah.
your what you're explaining, that it's exactly what we talked about in the beginning. You were born with the excess neurotic
Yeah, I
traits,
think that's
and
true.
that was not attended to the way that it should. You were not mothered properly,
Right.
or had
Or fathered at
enough
all.
paternal, yeah, exactly, because you need the soothing from the mother and you need the discipline from the
From the
father,
father.
but
Yep.
healthy discipline, obviously not
Yes.
beatings.
Not attempted
Yes,
murder.
right, exactly, exactly, not that. But we need to, for the, because I grew up with grandparents who were in Auschwitz-Birkenau. And
Okay.
so I grew up around PTSD sufferers. And what's best for this group is that their lines around their disorder is kept properly, is that the
Okay.
traumatic event is not something that is subjective to every person. And so for the clinical setting, we need to properly say that a traumatic event is the way that it used to be classified.
Okay.
Now they've changed it, which has allowed for this new CPTSD diagnosis to enter, because they completely revised the old PTSD
Okay.
diagnosis in 2013. So now it's all subjective. I'm not allowed to tell you that you didn't experience a trauma, because we are allowed to subjectively define it. But my point is that that hurts a lot of sufferers.
Okay.
So a trauma used to be something that any person that would traumatize any person who went through it. So it
Yeah,
used to be
like seeing
this
people's heads blown
specified,
off or
exactly,
yeah.
soldiers, where you realize that there is so much malice in the world, and I was naive, and now I have to be completely careful with everything. So they have this alarm system response, and they go completely inside of themselves and become a person apart. Well, what how you were explaining very nicely what you developed, and it's calmed now, which I'm very glad to hear. But you developed something quite different, something that could be interpreted as a histrionic
Yep.
personality disorder, which is
Yep.
attention seeking, need for admiration, which is,
Yep.
I am here, notice me. And that
Yes.
is very different from a trauma response, and need to be treated thus. It
That makes
needs to be
sense.
treated with guidance towards stability. And this is why DBT therapy works.
That's
Not
dialectical
great,
behavioral therapy.
exactly. It doesn't work great,
Okay.
but it is the best we have. And I have done it with patients, I've seen it work,
Hmm.
but it's bound to fail with clinicians, because what it's based on is that we provide this attachment that you were never given as a child.
Right.
So you have in cluster B, you have a defunctioning affiliation system, so bonding and attachment that was not given you, and you have this extreme need for, you don't know how to properly attach with people, so you get these unstable relationships,
Yeah.
and many are never able to form proper relationships. Then you have, with alcoholic parents, you end up choosing exactly what you were modeled. So you see
Yeah.
this with borderline personality disorder girls. They choose the alcoholic abusive men.
Yes, they do.
This is
Yeah.
what they come to, but they also make of people exactly what they expect. Is a self-fulfilling prophecy. So they assume you are a jerk, and then they behave in a way that will make you into that jerk.
It's a couple of things. Yeah, I love that you picked up on that. There's two things here. The borderline behavior, yeah. But first, I think when you are talking about differentiating between classic trauma, as trauma used to be described, and as it is described today, using this construct of CPTSD, which you think is not accurate and not helpful, um, I think the because there are people who believe that CPTSD describes them well, and who feel, I'm just describing their perception, who feel that, okay, they might hear you and say, oh, she thinks I wasn't traumatized, she thinks I had a good childhood, she thinks that
Mm-mm,
just
mm-mm.
because, right?
No.
So
Yeah.
I don't think you're saying that, but I do know that people hear that and feel that they
Yeah.
I'm not saying it's reasonable, I'm just saying it's
Yeah.
explicable that some people would interpret it that way, and they'd say, I really was mistreated, it really was difficult, I really do suffer emotional problems because even though my mother didn't try to cut my head off, she did everything short of that, right? So I
Yeah.
think that's where some of the pushback comes from, when they hear
Yes.
you saying you were not traumatized, and what they hear underneath that is you were not hurt in anything but the most mild and cursory way.
Yeah. I completely understand that. And I think we have to go back to saying, okay, but then we have to call BPD something else entirely, but don't put it into a trauma category, because then you are focusing the therapy on the trauma response, which isn't helpful.
Okay.
So then your problem is calling it borderline personality disorder. We have to go back to that. So that's why I
Okay.
started there. So I also think that when a child is not given the emotional closeness it needs, and it has heightened neuroticism, and they are not given, the parents don't take enough responsibility, the child experiences abandonment, and that is traumatic to us, right? That is the worst thing that can, it's existential threat.
To a child,
And
yes.
to, yes, to a child, and we grow up with that, and we see everything then through that, through our neuroticism.
Yeah.
We experience the one person in the world who was supposed to be there for me, the one person who was supposed to love me, didn't, because kids,
Yes.
we children, we equate attention with love. We don't understand the word love. Attention is love.
Right.
So that one person who was supposed to love us didn't. What is more, that's rejection. Then how is anyone else going to love us then? So
It's
that's how
it
they
is
grow
so
up.
it's so
Mm.
wounding. I don't think it's possible to communicate. I mean, one can describe it, but if a person has not experienced what it's like to realize, as I did at one point in my life, but as many millions of people with similar backgrounds have realized, when you do realize the truth that your mother, your own mother, does not love you, it is, if you haven't experienced it, I can't induce that, the depth of that feeling in some other person, but it is
It's
an
extremely
existential
empty.
horror. It is
Yes,
the hardest,
yes.
worst thing. When I realized it, I mean, okay, sounds a little histrionic, I know, but when I experienced it, I really did want to die. I wanted to
Mm.
die to
Yeah,
avoid that pain.
yeah. Of course. And then you numb it with drinking, which is a more aggressive, more male way
Yeah.
of
Yeah.
of doing it. It is because male and female aggression manifests differently. Male aggression outwards, and female aggression more inwards and
Yeah.
towards relationships. And but I think that this condition, this cluster B condition, needs a lot more attention because we have buried the roots of it because of feminism, because we needed to get all the mothers out to work. So we downplay how important and how difficult it is to parent. So back to that, I think that we are creating a lot of these we're traumatizing, to use this word, a lot of people, a lot of and they are now adults. This
Right.
is an old problem now
Yeah.
because we completely misunderstand what kids need. We think kids need to be socialized. No, no, they need to be quantity time with their mothers. We need to feel that our mothers want to give us attention, aka love. And so it's so easy to give kids this feeling. And then if you have this excess neurotic trait, so for some kids, they don't need, they're fine to go in the daycare. And they're then being highlighted as, look how happy these kids are in
Yeah.
daycare. But they're very low in neuroticism and
Yeah.
very extrovert and very, you know, conscientious, and they don't need the same things. That's why you have this group of siblings where they manifest very differently. And one says, I had this terrible childhood, and the others say, oh, shut up already.
Yeah. This is you said something earlier I really want to get to. You said you think that it's a lot easier to create the cluster B disorder than we have been aware of. And I'd like to hear more about that because this is something I talk about with a couple of friends who are also interested in this kind of perverse psychology. And one of my friends has a model that I like. She calls it the good enough parent.
Mm-hmm.
So, and this is a model. It's general, it doesn't apply to every situation. But imagine that you have a parent, a set of parents who are, they're not perfect, but they're not abusive. They love their children, they make mistakes, but they're good enough, right?
Mm-hmm.
They're
Yeah.
normal range.
Yes.
And so those so this family with the good enough parents exists in the 1950s with the social atmosphere that we have there, and their kids grow up to be just fine. Fast
Mm-hmm.
forward 50 years to around the turn of the century, or fast forward into the smartphone era, and all of a sudden, these same parents, these same good enough parents with the same traits and the same parenting behaviors, are winding up with cluster B kids or really screwed up kids. And my friend's model assumes, and I think I agree with it, that what was good enough psychologically for many kids in a different world is no longer good enough, and that the outside world, not the parents' behavior, but that the outside world, the school and social media is contributing to the development of personality disorders. What do you think about that?
Absolutely, absolutely right. It's a combination. It's also so. I think I mentioned this also on the show. This thing with the birds, that they, in high predation area, they upregulate the trait neuroticism. So this is why when we have this, and now we're living in a constant sense of danger,
Yeah.
and the online validation loops. Right.
Yeah.
So in a digital world, we're living in this very heightened. So if you already have the tendency towards feeling negative emotions, feeling threat, because that's what neuroticism is, I'm under threat, do
Yep.
something, then that, you know, you have a lack of attention, for a lack of responsiveness, lack of soothing, right? It's not just the attending to, it's that we learn emotional regulation from our mothers. We need to,
It's
right?
no wonder
We
I didn't
need
learn
to,
anything.
right? We need to, especially for girls. With boys, it's that they need that impulse control that they
Yep.
get from their fathers. But this, how to soothe emotion, that we get from the mother. And then when you don't have that as a kid, you get it negatively impacts the development of the HPA axis. The cortisol levels are constantly high, and then you go into this digital world where it's a constant loop. And so, of course, how can that not have an effect on us? We very
Yeah.
much downplay the effect of parenting and the environment, and we're atomized and we're productivity driven. And women, I'm sorry, I'm going to say it now, we are meant to child rear in groups. We are meant to have a close knit group where we care of our children together and the men go out to hunt.
Yep.
And 50 years of social theory is not going to
Yes.
change that. And
It's
we have to think about that. Now you see this adult female friendship epidemic. I have no friends epidemic is called because
yeah.
women don't have friends, and they don't have friends the way we're meant to. We're meant to have shared goals and activities.
Yeah.
And so
Yeah.
that's also a contributing factor why this upregulates, because it helps this sense of something is not right. I'm not living as I'm supposed to be living.
I think that afflicts so many of us in modern
Yeah.
Western society. Um, I definitely see it in women. I mean, it's one of those things where almost all the things that I grew up being taught and believing were merely oppressive, sexist claims against women have turned out to be just plain old truth and
Mm,
old-fashioned wisdom that was never
yeah.
abusive, right? But the it seems very clear to me that the surfeit of completely dysregulated women, middle-aged women and older, the screaming leftist harridan, right?
Mm-hmm.
There are so many, they're everywhere. You can't go outside without seeing them. You can't open social media without seeing them. I really do
Yeah.
believe they're like this largely because they don't have children or they don't have a tight-knit family home. They've divorced their husbands. I mean, I'm not saying their husbands, they have their own set of problems, but I
Right.
I really do think that that it used to be that I mean, my mother's a good example. My mother is 70 years old now. She was born in 1955 and into a poor family. And her parents were abusive as well. Um, there was alcoholism and all, it's the family history that you would expect to see. If I were your patient,
Mm,
you would not be surprised at the inventory you took of the family history. Um, and she had me when she was 19. My father left before I was born. I mean, she made some bad choices starting right out, but she was in bad circumstances too. She didn't have the parental guidance that she should have had, and then she ended up with three children, my brother and sister and me, two different fathers. Um, no one else in the home to help out. Very stressful. I mean, my mother did have real problems. Even though she was an abusive, horrible person, she's also a person, and she was abused herself.
mm,
And she would, I know, because I remember the things she would say, I know how lonely she felt.
mm,
Not only lonely for a man and a husband to love and to be a father, but also not having the girlfriends, not she had a fractured relationship with her mother. So it wasn't you couldn't count on the
yeah.
aunts and uncles and everybody in a group family setting. So I know that was a big deprivation in her life as
Yeah.
well. And I see it in millions of people.
Yeah, I think that's a good analysis. That there's a lot of insight there. And I just wanted to say one thing more about the CPTSD diagnosis here. And that is, if you look at the symptom list, it is almost undistinguishable from the list of symptoms we use for borderline personality disorders, the feelings of worthlessness, emptiness, this yeah, this chronic I'm unworthy, and it what I see when I've managed to help these women, these
Hmm.
borderline women, that has been when they attach to me, which means they care about my opinion, they seek
Yeah.
validation and approval.
Hmm.
Uh, we have regular sessions for a long time, and then I'm able to guide them. And say, okay, this is, this is not appropriate, or maybe we'll look at your past behavior and see how that was disadvantageous. And then, you know, if they're able to get into a long-term stable relationship, marriage, and have
Yeah.
children, that is what will get them to a functioning life.
Okay.
What doesn't help them is to sit session after session trying to unlock a black box or unpack memories that they remember or don't remember, and
Hmm.
concentrate a lot on the feelings, because those aren't the point. The depression is there, but you need to act differently. But that is what you have to
Yeah.
try to encourage in these girls. And so that's why I just sort of harp on about, let's not lump this into this already quite vague and difficult to handle category of diagnosis, the disorders, into this other where they don't really belong, simply because we find it unpalatable to say that you have a personality disorder or this
Okay.
is the behavior. And it is because it's very fashionable to have trauma. And
Yes, it is.
we do live in a victimhood culture, and it's problematic when we let everything be seen through that lens. So I can say this abuse and neglect was traumatic, but this isn't a trauma response. This is an ongoing development of maladaptive strategies that we somehow need to
Okay.
calm by acting differently.
Right.
And that is sounds like a very simple solution, but is
No,
fiendishly
it
difficult
is.
to
It
do,
is.
right?
Do
It's
you
complicated, very
yeah.
difficult.
Do
Mhm.
you see people? All right, so I'll describe I'll describe how I've thought about this sort of on a spectrum, and I'd like to know what you think. I might change my mind. So how I have thought up till now is, well, and I think generally that there is, as I said earlier, there is a state of mind that can accurately be called cluster B. We might call it something different in 100 years. It might have a different label, but the referent, the state of mind itself, is a real extant thing that we can recognize
Mhm.
in people. But that it's much harder to say they're only antisocial, they're only borderline, usually there's a mix of things in there. That's one thing. But I have also conceived of it as almost all of the traits that we call personality disorder traits are actually just human being traits, meaning most of us at one point in our lives, even those who are not personality disordered, will experience or engage in some of those traits. You don't have to have a personality disorder to do projection,
Absolutely.
for example. Do you agree
Hmm.
with me so far?
Yeah, absolutely.
Okay,
And some
so
are very, if
let
you're
me
very
just take it out to
conscientious, sorry.
let me take it out to the end. Um,
Yeah.
so I see a gradient where,
Mm.
and I've conceived of it this way, like um, normal range person here at this end of the gradient,
Yeah.
then one level up CPTSD, then a level up from that and I'm going up in levels of severity of suffering and behavioral expression. So normal range, what I've been calling CPTSD, then borderline personality disorder might be the really florid expression of that. I understand that you don't use the CPTSD model. I get that. But do you agree that there is a gradient where there are people who go from normal range with only very occasional emotional dysregulation to people who don't qualify for a full cluster B diagnosis but have elevated traits, to those who really are florid? Do you see it that way too or not?
Yes, absolutely. You have a spectrum. Yeah. But I wouldn't call the middle level PTSD
CPTSD.
because that gets us
How
off
do
track.
you what do you call it?
I would call it, and I have called it, because you have to put always a code, and there is a code for exacerbated personality traits.
Oh, okay. I did not know that.
Yeah. So
Okay, so
that's a
that's an
much
actual
better, because
recognized
then you know how what
construct
to deal with.
in
Yeah,
the
you know what to
taxonomy.
deal with.
Okay.
Exactly. You know what
Fascinating.
to do. Yeah.
Is that in
And
the
this,
is that in forgive my ignorance. Is this in the ICD system
Yes,
or the
this is the
DSM
ICD-10.
system?
I think there is one in the DSM too. I can check
Okay.
that. Yeah, this is the
Okay. Some
yeah,
people have
no.
described that as subclinical personality
Yeah,
pathology. Is
yeah,
that another
yeah.
way to
And
describe
this
it?
is not included, those are not included in the studies on measuring prevalence, subthreshold,
Because
subthreshold levels.
it looks to me like I believe that both that the absolute, not absolute, the percentage of the population today who has a
Hmm.
fully diagnosable cluster B disorder is far higher than it was 50 years ago and higher than the prevalence rates suggest. So I'm talking about fully diagnosable, not gray areas, not subclinical.
Absolutely.
But I also believe, and this group of people, I believe it is probably even larger than the group of personality disorder people. I think
Yeah,
we have a huge number of people with exacerbated traits that are severe enough that they are causing cluster B type dynamics all over the place, even if that person doesn't go all the way to personality disorder. What do you
yeah.
think?
I think that's absolutely true. I agree. And that's what I'm sort of fighting a little bit to bring attention to.
Okay.
And that we need to change our whole value structure to stop this from happening, to slow the spread, because we are all suffering. These
We are.
behaviors inflict harm on others.
And on it's
Yeah,
it is everybody. They people we hurt ourselves when we do it, but we do hurt other people.
yeah.
And this is everybody asks me this when you get to the end of a conversation. I'm going to ask you the question that everybody asks, and everybody asks it of me too, and I don't know how to answer it. What do we do about it? Um,
Well,
and that's not something that we could answer with 26,000 hours of conversation. We'd still be asking the question. But when people ask me that, I heard you say it a minute ago, we have to completely change our value structure, and I agree with you. I really do think there are multiple, maybe even infinite influences that are making us be the people we are today that we're participating in. We can't
yeah,
control all of them, but I think if we
no,
had to grab onto one or two, getting back to normal old-fashioned family structure would probably be one of the most effective things. What do you think? What are our best bets, Hannah? If we want to
yeah,
change this, what do we have to look at first?
exactly that. We have to lean more conservative. We have to bring faith in more religious activity. And we do see that conservatives suffer way less from mental disorders than the liberal leaning.
Yeah.
We have data on that, and I think that is exactly the reason we need uh, we need to have a framework that guides us better.
It, sample size of one, but my my own mental suffering, and I'm sorry for how twee that sounds, is so much less than it was when I was a hard liberal. I
Yeah,
mean, it just, and there's a lot of this is correlation. It's not like, okay, I decided not to be a liberal and that cured. No, no, I don't mean that. These things all sort of came as a package and a number of influences go in that direction. But I see it in people. I see that, if you're, it's, it's not uncommon. It's not as if a lot of people think because everything has become so partisan that when somebody notes what you just noted, that people who are politically conservative tend to have less mental suffering, less diagnosed mental illness, they think that means that you're saying, well, anything, if you believe in anything liberal, that means you're insane. And if you believe in anything conservative, that means you're a good person. And that's not what it means. It's not as if there are no cluster B people on the right or no abusive people on the right.
mm,
But I'm sorry, I'm afraid that at this point, and I spent most of my life as a hardcore Democrat, liberal, male feminist stereotype. I
yeah,
believed all this stuff. My mother was an avowed feminist. I was raised with this shit, you know. I learned
Mm,
very early that I was bad because men are essentially bad, and I
mm,
internalized it and believed it. So I
yeah,
know what it's like.
yeah.
And
Well, I'm
you
trying to
are
fight all this
you don't
on
find
Psychobabble.
this on,
Yeah,
you know, if you're talking to somebody who is deeply neurotic, deeply emotionally activated about everything, it's almost never a conservative.
yeah. It's and that's true. That's why I call Psychobabble conservative compassion because I come
Okay.
at it from a very compassionate place. I want to help,
Yeah.
but in a conservative way.
Have you
And
always
I'm
been a
the only
conservative by disposition,
no,
or
I was a
did you used to be
feminist.
a liberal? You were a
Yeah, yeah,
feminist too?
yeah, very hardcore feminist. But we can, so we can have another
We're
chat
gonna have
about
another.
that.
We'll have another one. Yeah. It
Yeah, I
just
was a feminist. Yeah,
okay.
yeah.
That's oh okay. Now I'm planning for the next one because I would
Good.
love to hear yours. I want to hear your story, the whole autobiography.
Okay.
Um,
Let's plan it. Let's plan it. It's always
very
great to
good.
talk to you, Josh.
Hannah Spear, thank you so much for spending time. We got to get to all the
Thank
things that we
you.
didn't have time with when we were doing it on camera.
Yeah, I'm glad I got to clarify some things. Yeah.
Me too. Well, we will have you on again, but for everybody listening, this is Dr. Hannah Spear, Spier, and tell people where they can find you and your work online.
Yes, come to my Substack, Psychobabble with Spear. And that's or YouTube at Psychobabble with Spear as well. So all of it is there. Great content, great episodes. I've got Bettina Arndt coming on this week, so I'm
Ooh,
very
she's
excited
excellent.
for
Bettina Arndt, for those
yeah
of you who don't know, is a really
male advocate.
formidable
Yeah.
woman who is anti-feminist.
Yeah, so I'm on Substack as the anti-feminist psychiatrist.
You're really waving a red flag in front of those female bulls, aren't
I
you?
am. I am.
Hannah,
Enjoying every second.
thanks very much. We'll talk to you again. And
Thank you,
everybody,
Josh.
this is Disaffected. Thank you for listening.